On November the 18th, I went grocery shopping and found myself suddenly thrown to the floor. The store manager came and asked me my name, and I said my name, but it was slurred. He told me that I was having a stroke, that my face was sagging, and I was also paralyzed, the left-hand side of my body, completely paralyzed. I couldn't get up. I went to the Brantford hospital. I was rushed by ambulance, so they determined that I needed the procedure called EVT, and that couldn't be done at the Brantford hospital, so the ambulance drivers quickly took me to the Hamilton General Hospital.
EVT, or endovascular therapy, it is a highly specialized life-saving procedure that we can actually use in patients with large blood clots that are blocking a major artery in the brain. It's a small surgery, which is done in a place that looks like a small OR. It's called angiography suite. So patients are transferred into this suite, and after some local anesthesia in the groin, then a wire is placed in that femoral artery. It's a very big blood vessel in the groin. And then with the use of X-ray based imaging, it's navigated carefully all the way up to the brain. And once it reaches that area of occlusion, then we can use either a suctioning machine or a stent to mechanically remove this clot, restoring blood flow.
They performed the procedure, and I think it was completed in about 20 minutes. And when the clot was removed, all the feeling was restored on the left-hand side of the body, the facial drooping went away, and the slurred speech became normal.
EVT in our region, in the Central South region of Ontario, is performed only here at the Hamilton General Hospital. Our hospital's EVT team includes stroke neurologists like myself, along with neurointerventional physicians, fellows, residents, anesthesiologists, interventional radiology nurses, and technologists. Along with having a good functional status before this procedure, the other things that are important in terms of qualifying for endovascular therapy are being able to get the treatment within generally 6 hours, but we can do it in selected cases up to 24 hours. And again, having blockages in the brain, in the large vessels, that can be reachable with these micro wires. Before endovascular therapy was available, then we could administer clot-busting medication. The clot-busting medications tend to be less effective in larger clots. The most important factor to have and be able to have a good outcome is to come to the hospital fast. And the reason for that, and the reason why we always say time is brain, is that average for one of these large sort of clots in the brain, we lose about 2 million neurons a minute. You really need to come to have the best chance at recovery.
I'm very, very grateful to be alive. I could be paralyzed and in bed. I could have speech difficulties, a whole range of symptoms depending on where the stroke hit in the brain. I was able to, when it was time to be dismissed from the hospital, I was able to go get my own wheelchair, put my suitcase in it, and walk out the door.